All right, welcome back everyone. Right now we're at the board and I want to talk about heart health, okay? There are nutrients that provide vitality to our overall heart, our circulatory system, and everything in between, because believe it or not, every nutrient we take into our body has a purpose. And here on the board today, I've got some nutrients that I want to talk to you about that have a direct effect on the cardiovascular system and will make you feel great, because the whole point of this is to improve your overall vitality. Now let's start off with a nutrient that many of us, we've heard about it, but why do we take it? Now, we know about CoQ10, but there is a even better type of CoQ10 called microactive CoQ10. Remember, these nutrients enter our body. They're very, very small, but we have to get them to absorb properly. But why do we need CoQ10? Now remember, many of you take statins for cholesterol. Statins, when they enter the body, deplete our body of CoQ10. So even though you're lowering your cholesterol, you're actually increasing your risk for heart disease, because if you have no CoQ10 in your body, you are looking at a heart attack or stroke. So this is a very important nutrient. So here's the thing about microactive CoQ10. It is stored in the mitochondria, which is the little energy factories in our cells. Every cell has mitochondria, and these produce energy. And to have good energy, I mean, when I take CoQ10 myself, I can feel it. So this is what you want. You want to feel that energy. So you want to make sure that your CoQ10 levels are optimal. This is stored in the mitochondria. Also too, believe it or not, that as we age, if you're eating a poor diet, you're not exercising, you're overweight, you will actually decrease the levels of CoQ10 in your body naturally. So what happens? You're setting yourself up for a risk of heart disease, and you need to reverse that. And the great thing is, you can take it, swallow it, and you're improving your health immediately. All right. Also too, restores energy. Like I said, this is the nutrient that restores energy, but I want to share with you a couple of clinical research studies that I found very interesting when it came to microactive CoQ10. Now listen to this. In a study of 420 people with heart failure, they did the treatment with CoQ10 for 2 years. It improved their overall symptoms and reduced their risk of dying from heart problems. It shows you how important CoQ10 is. Here's another research study. 641 people were taking CoQ10 or a placebo for 1 year. At the end of the study, the CoQ10 group had been hospitalized less frequently for worsening heart failure and had fewer serious complications. This is a nutrient. I mean, even the man that wrote the book on it, Dr. Stephen Sinatra, who I've interviewed probably 5 times already, is huge on CoQ10. We need to take it every single day. So these are the things that we need, this nutrient we need in our body. So any of you are taking heart medications of any kind, CoQ10 has to be added to your daily nutritional regimen. Now let's look at grapeseed extract. Now many of you may have taken it a time or two, but you may not really understand why you are taking it, and you probably thought, it's a great antioxidant, I hear it's good for the heart. But then you get complacent and you forget about taking it. Well, here's how important grapeseed extract is when it comes to heart health. Now, many of you, so I'm going to give you a quick little heart lesson here, because nobody ever figures this out. So you have high blood pressure, or blood pressure in general. You go to the doctor and they say, your blood pressure is 120/80, which would be great and normal. Well, systolic is the top number, okay? So that would be like 120. Diastolic is the bottom number, which would be like 80. Now, my overall blood pressure is 110/64. And I can explain that on another day, but I take a lot of things that improve blood flow. So this is important. Grapeseed extract is a very powerful antioxidant, but it works with blood pressure. And here's the thing about heart health and antioxidants. You make sure you're taking antioxidants every single day, because you're going to prevent cholesterol from oxidizing. When you prevent your cholesterol from oxidizing, your LDL number, the bad cholesterol, does not increase. Think about that, okay? All right, next. Mena Q7. This is a very particular type of vitamin K2, okay? So I'm gonna move over here real quick because I'm left-handed, so. All right. Vitamin K2 has been overlooked for years. And many people think, well, I can't take K2, clots of blood, blah, blah, blah. Well, yeah, you want your blood to clot, especially if you cut yourself, okay? All right, but here's the coolest thing about vitamin K2 that they found in research. It removes the calcification out of your arteries. Anytime you take calcium into your body and you do not have K2 in your body, probably because of poor gut health, the calcium doesn't go directly to the bone, it will settle in the arterial wall, leading to hardening of the arteries. That's a no-no. But taking vitamin K2, the Mena Q7, actually helps to flip the switch. So when you have vitamin K2 in your body, you have vitamin D3 in your body. The calcium doesn't go into the arterial wall, it goes to the bones, the teeth, it goes for nervous system health, it helps with muscle contraction. We don't want calcium in our arteries. Did you know that research shows that men as young as 35 have calcifications in the aorta, the largest artery in the heart? That's a no-no. All right. Here's the thing I also learned about vitamin K2. Did you know that if you have increased calcifications in your arteries, it it would increase the signs of aging, but by taking vitamin K2, it reduces the signs of aging. Now here's what they talk about aging. When you have vitamin K2 in your body, you can actually look younger than your years. If you lack vitamin K2 in your body and the calcifications are building up in your arteries, you will actually look older than your actual age. I thought that was a really weird study, but it was true. So here's the other thing. Protects the arteries, and vitamin K2 prevents the calcifications. Vitamin D3 takes the calcium where it can be used. So you have to have them together when you take them because it's perfect heart health. Remember, when we talk about heart health, it's not always about the actual heart. It's about the circulatory system. What do your arteries look like? Are they clean? Are they clear? Or are they just getting narrower? Remember, if your arteries get narrow on the inside, your blood pressure will increase because the pressure is increasing to push that through there. Also, too, here is a combination of nutrients for great heart health. Hawthorn berry extract, bilberry extract, resveratrol, and olive leaf extract, they all work together to normalize blood pressure. If your blood pressure is high, it can help lower it. And with Hawthorn, this is a heart tonic. Okay, it strengthens the heart overall. It's one of the greatest circulatory herbs ever found in nature. Also, too, they all have antioxidant support. You need that for your arteries. You need that to prevent the cholesterol from oxidizing. Also, too, olive leaf, as we know, is along with resveratrol, are also great for immune support, okay? If your immune system is dysfunctional, it can actually relate to a lot of your cardiovascular elements as well. Now, all of these nutrients work together synergistically. And, you know, Brightcore Nutrition has a product called Vitality, which I absolutely love, because one thing I want to make sure that works every single day is my heart. I want my arteries clean and clear, okay? Now, this is something that everyone can take on a daily basis. You can take it just for normal heart health support. But if you have issues with if you have blood pressure issues, maybe you're not getting enough CoQ10 into your body, maybe you're lacking that vitamin K2, Brightcore Nutrition's Vitality is the one to get. So hey, stay tuned. I'll be right back with more.